that by the year 2010, we'll be short by about 1,260 nurses in the system, which is it's scary. But the Corpus Sanchez report makes a similar prediction as well. So perhaps the minister could tell me then if he does know now, and if not, then will he get those figures for me, please?
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. Mr. Chair, I don't have necessarily those specific how many we're going to have trained within that certain amount of time, but just out of the 223 individuals, those individuals will be trained up within 2 years, which is the LPN program, and of course the RNs, the 70 new seats will be trained up. I believe it takes 4 years to go through that degree program.
Thank you. Order, please. We have arrived at the moment of interruption.
That's it. I'm done.
Order, please. We have arrived at the moment of interruption. Tonight's debate was submitted by the Honourable Member for Digby-Annapolis. Therefore, be it resolved that the Nova Scotia Government recognize the significance of the ferry service between Digby, Nova Scotia and St. John, New Brunswick, and its importance to the economy and prosperity of Nova Scotia. The Honourable the Member for Digby-Annapolis.
Thank you, Mr. Speaker. I'm very pleased to rise to my place tonight and speak about this important matter for my area, Digby-Annapolis. I want to start way back. I know I've only got 10 minutes, but I'm going to go back 200 years, and because that's when the ferry system started in that area. There was a ferry down there when Joseph Howe was riding around this province on his horse. There was a ferry system coming across that bay because they knew then that would be a vital link to this province from other provinces and other countries. So it's been here, that ferry system's been here longer than some bridges and some roads in this province. Many bridges and many roads in this province. And to lose something like that, I mean, this boat is probably, you could look at it as part of our heritage. But a lot more important than that, it's a part of our way of life. And I mean, there's bridges in this road. It's been told, you know, that boat can be taken out of there and you can drive around the Bay of Fundy. Well, you can see St. John across that bay on a fine day. And just the same as you was living here in the city of Halifax, and you can see Dartmouth over there and throw a rock to it. So maybe if we're going to start taking the infrastructure of ferries out of this province, maybe we start taking the bridges out too. And probably the folks could drive around here to Dartmouth if they wanted to go to Dartmouth. Another reason was, well, it's not making any money. The ferry system doesn't make any money. So, but I would like to see on the books in this country what piece of infrastructure that's put in for moving traffic and people and goods around that does make money. I don't think you'll find anywhere that makes any money. The folks even said down home there, you take that Bear River Bridge out on the 101. Take that out, we can drive up around Bear River. It'll only take you another 25, 30 minutes. So start taking everything out if you're going to take the Digby Ferry boat out. I want to give you a little an idea of the cost that could be, the impact, you know, for this area. And it was done by the Maryport group of the Digby area. And that impact is between $36 and $51 million per year. It's dependent on the losses to the fishery, in the fishery. The trucking cost extra to go around would be $11.5 million if that ferry wasn't there. The loss in product value, $12 to $24 million. Environment and social costs, $7 to $11 million. And tourism losses of $5 to $6 million. That is their report to the federal government. The Minister of ACOA, Federal Minister of ACOA, said here a year or so ago, he said to the folks of this province and down there, use it or lose it. That was his comment about the ferry. Nothing more. That was the comment that was stated, use it or lose it. Well, Mr. Speaker, we need more time to be able to use this. And I'll give you some examples. We had a company come from the South Shore that wanted to expand here a few months ago, and they was going to come to Digby. But the first question was, is this ferry going to be here? Well, we don't know. We wasn't given any idea if it's going to be here. We know it's here till January 2009, but beyond that, we're not sure. So this company said, well, I'm not sure either. I can't be sure. If you're not sure if the ferry's going to be there, this company moved to New Brunswick, Mr. Speaker. He moved to Campbellton, New Brunswick. Right now, we're looking at sea urchin business. It's in Portland, Maine, that they're going to come here. They buy the sea urchins here from Digby area, Nova Scotia, Newfoundland. They want to come process them in Digby. I'm talking to these people right now. Is that ferry going to be there? They need that ferry to cross that bay. It's part of their business plan. But Mr. Speaker, we can't tell them that. We don't know. If we had word from the government say, okay, you've had a couple of years to try to get some business going. Here's a couple more years to try to get some business going down there so you can use it and won't lose it. Give us something like that. But this use it or lose it deal by January 2009 is not going to work for us. Mr. Speaker, we've even talked to Senator Tarr, Senator Bruce Tarr in Gloucester, Maine. And they have built a $7 million terminal down there. And his dream is to put a ferry here to Nova Scotia. I've talked to him many a times that he would love to come to Digby, Shelburne, Yarmouth, wherever he could get. But nobody seems to want to talk to him about that piece of infrastructure. I know he's been to Digby a few times. You know, there's a construction boom, Mr. Speaker, that's going to happen in New Brunswick in the next few years, and it's going to be worth $44 billion. And this massive building boom could be part of Nova Scotia's economy. But according to the people in New Brunswick, if that ferry system's not there, it's not going to work because they're going to need tradespeople. They're going to need companies in the Digby and Yarmouth and Valley area to be able to do construction for them here, to be sent across for this $44 billion boom. Going up around for 8-hour drives on the roads is not going to work. And let's get to roads for a minute. We've had a ferry there for 200 years. There's roads going from one end of this province to the other, being doubled, being rebuilt. From Digby to Weymouth, where this ferry boat comes in, we don't even have a single 101 there yet. We don't have it yet. For 35 years, that's been going to be built there. And it's not there today. So I'm not sure, you know, where is our infrastructure going? We've lost the Prince of Fundy in Yarmouth. We've lost the airport down there. We've lost the railroad tracks. They're gone. So we have the infrastructure of that boat there left in Southwest Nova. That's what we have there, Mr. Speaker. And if you take that boat out of there without having a vision of what's going to happen there, and I can see the vision. I can see New Brunswick fish growers coming there. I can see a boom from New Brunswick for the nuclear plant, from the LNG plant, just hoping and praying that they can get some workers from that area. So, Mr. Speaker, I know I'm running out of time. I wish I had a little more, because I got lots here to tell you about what's going on down there. Anyway, with the high price of fuel and stuff, it's going to be necessary to have that boat, because there's only two ways that you can move goods and people around economically, and that's by rail and water. We've lost the rail, now we may lose our water. I've always told my children, Mr. Speaker, that you should think twice and act once. I told them that all my life, and today they're telling me that. They tell me that now, that I think twice and act once. I think this government and the federal government should think twice and act once about the Digby Ferry being stopped going across that bay. Thank you very much.
The Honourable, the Minister of Economic Development.
Mr. Speaker, I'm quite prepared to provide the honourable member with another couple of minutes if the House would give me unanimous consent.
Is it agreed? Agreed. The Honourable, the member for Digby Annapolis.
Thank you. Thank you, Mr. Speaker. I would like to just touch on the gateway funding. The gateway funding, you know, we hear tell of the gateway funding, building twinning roads up to the east, up to Cape Breton. That's great to build a wonderful terminal up there, you know. But what about the gateway funding to the western, to one of our greatest trading partners in the world, the Americans? A little slow right now, but that's all going to come back. It's going to come back. America's still going to be our biggest trading partner. And if we can build the infrastructure to the western part of this province, I believe we can have great connection with the Americans. Senator Bruce Tyre out of Gloucester's ready to go. He calls me all the time and asks me how I'm making out in Digby. Are we getting things corrected? He talks to the company of Bay Ferries and doesn't seem to get any satisfaction there. Anyway, I just believe that if there's going to be gateway funding for this province, that it should be equal. If there's going to be ships coming into the eastern, we need ships coming into the western of this province. And if that doesn't happen, it's not going to be fair for this province, and more so, it's not going to be fair for the people in western Nova Scotia. Thank you very much, Mr. Speaker.
The Honourable, the Minister of Economic Development.
Thank you very much, Mr. Speaker. Mr. Speaker, I want to thank the honourable member for bringing this resolution forward. I think it's an appropriate time to have the discussion with respect to that very important service for that part of the province. And I can assure the honourable member that it is a matter of considerable concern to this government, and it is, I hope, in the course of my remarks that I can demonstrate that while it is of concern to this government, it is not a problem that this government can solve entirely on its own, and we do need a partnership in order to do that. And I don't say that from the point of view of saying that you know, somebody else is to blame. I say from the perspective that we need to work together. I am concerned, for instance, that New Brunswick may not see this as being as important as we see it. I have not seen indications from the province of New Brunswick that this is something that they look to the future with the same level of concern that we do. And I hope that the comments by the honourable member with respect to the activity that will be taking place in St. John, New Brunswick over the next number of years will indeed bear fruition, and that will be seen by the government of New Brunswick as something that is a very good reason for them to become involved and to partner with us in the longer term with respect to ensuring that that service continues in the manner that it should. I was recently somewhat encouraged to see that the city of St. John, New Brunswick did indeed take the decision to comment on the need for that continued service. And I saw that as a glimmer of hope, if I could say that you know, there may be some increased motivation within New Brunswick to see that happen. So the honourable member this afternoon, Mr. Speaker, I believe, did bring to the floor of this House a very compelling argument as to why New Brunswick should take a greater interest in that. And by the same token, the same argument applies as to why our federal partners also need to continue with us. I was quite interested to listen to the honourable member speak in terms of bridges and existing roads and things of that nature, because it was interesting. At the time we took the decision to put the money in the continuation of this service that we did, I was Minister of Transportation at the time, and I had asked if we had a road to New Brunswick from Digby, what would it cost us to be able to maintain that road and keep it operational and functional throughout the course of a year? And it happened, Mr. Speaker, that the number would approximate the amount of money that we have committed to the continuation of that service. So that's a number that's fair and appropriate for us to be looking at in terms of the continuation of that service into the future. There is a rationale that says we should in fact be doing that, and I found that to be quite interesting at the time. And that's not to say that that's the only thing that we should be doing, but I believe we also need, in consultation with the Government of Canada as well as the local communities, need to look at a bigger strategy with respect to transportation in Southwest Nova. I think it's very important that we take advantage of this challenge, if you like, to be able to focus our attention on the future, assess our needs, see what it is that is appropriate from a go-forward basis. And in doing that, we need to recognize that the service that is in place now is a service that replaced the service that was provided by the Government of Canada through the government ferry service that was in place there. And I think it was somewhere around 1997 or thereabouts that the federal government got out of that. And the federal government at that time were putting in $17 million into the provision of that service, that ferry service. And the Bay Ferries came in and carried on providing the service in Digby and as well as Yarmouth, and filling the gap of that $17 million deficit in order to be able to go forward. So I point those figures out so that the House understands something of the challenge that Bay Ferries was attempting to meet as it went forward. And of course, it relates to the challenge that we're now faced with as a provincial government, looking for partnership with the Government of New Brunswick, and of course, looking for partnership with the federal government on a go-forward basis to ensure that we have a strong, viable service there into the future. And I believe that analysis would, of course, take into account the points that the honourable member was making with respect to the increased demand and traffic that would occur as a result of the increased investments taking place in the St. John area. So that's one of the things that we want to see happen as we look to the future, is to ensure that we take advantage of this challenge to do the appropriate analysis of what the needs are into the future, and then to ensure that we are prepared to meet those needs. Now, Mr. Speaker, we can't avoid the fact that there has been a 22% decline in passenger traffic over the 5 years previous to 2006. That's a reality. That's part of the challenge that we face, and we need to find ways of increasing that traffic. We need to ensure, and the honourable member has made some good points when he talked about the need to be able to look forward into the future with certainty that the service will be there, because that's part of what you need in order to be able to keep the service going into the future. So that is another reason as to why we would want to ensure that we had the assessment that needs to be done with respect to looking to the future. And as I've indicated, the province is committed. There is a rationale for us to be able to go ahead and continue providing support to that service. However, when you look at the history and you look at the deficits that were there that were covered by the federal government in the past, those are not figures that are appropriate for the province to be asked to consider on a go-forward basis. So we do need a partnership with the Government of Canada and a partnership, I hope, with the province of New Brunswick, who would see this as an integral link between the two provinces. So, Mr. Speaker, I thank the honourable member for bringing this issue forward this afternoon, and thank you for the opportunity to speak to it.
The Honourable, the member for Queens.
Thank you, Mr. Speaker. And I'm pleased to rise in my place to speak about this very important issue for Southwest Nova Scotia. And I want to just reiterate some of my Liberal colleagues' comments on the importance of the Princess Acadia and what it means not only to Digby but all of Southwest Nova Scotia. And I'm pleased to also hear the Minister of Economic Development indicate that he too and his department is very concerned about the moving forward of this ferry and trying to keep it alive and well. Not only is this a vital transportation link for many industries along Southwest Nova, such as the fishing industry, the forest industry, the tourism industry, and small businesses such as Frenchies that depends on bringing their product from from different parts of New Brunswick and New England, and they rely on this ferry service to make their business strong and viable. The economy of Southwest Nova Scotia is being hit, every year with impacts, out-migration of youth, declining population, and we can't afford to lose economic dollars out of Southwest Nova Scotia. So this vital transportation link, if we're able to find the solutions to keep it moving forward, will play a major role in keeping the economy of Southwest Nova strong as we move into the future. My colleague indicated some of the economic impacts should this service close in January 2009. Our struggling industries can't afford to lose this service and move to transporting goods through trucking around the Bay of Fundy. It's just too costly for those industries. The ferry service has always offered a more viable and efficient service in terms of fuel costs and certainly a quicker way to get their goods to market. And so we don't want to see the service disappear and then have to make a digressive step moving our products through trucking routes. It's just not viable. And there's no question with the high fuel costs and the operating losses that the ferry has seen, there are tremendous pressures that we're seeing for this ferry. And the $8 million that was injected by Ottawa, Nova Scotia, and New Brunswick to help stabilize this service until January 31st, 2009, means there's precious little time for us to really come up with some viable solutions here. And I'm encouraged that the Minister of Economic Development has indicated a willingness to act more aggressively and to look at partnering with other stakeholders here. And I would encourage the Minister and his department to take the leadership in bringing these partners to the table. And when I talk about stakeholders, I'm talking about about all stakeholders. Transport Canada and ACOA need to recognize that they just can't kind of pull out, in 2009 and say, okay, we're done, we have nothing more to contribute. Other stakeholders that are very, very important to be around the table are industry representatives from fisheries and forestry and tie-ins, and also the business communities need to be part of finding solutions, as well as labor and Bay Ferries, of course. They all need to be able to sit down and discuss some of the challenges and come up with some solutions to make this a viable, sustainable transportation link. And I have faith that there are solutions to be found for this viable service. And we need to look at all possibilities of investment into this. It's important to the economy of southwest Nova Scotia. We can't afford to lose the tourism dollars, and I do understand that the passenger numbers have been declining, but tie-ins and the industry has been moving forward with good marketing initiatives, and if we can just be a little bit more aggressive in those initiatives, then I'm certain that we can turn those numbers around. We have a beautiful province to promote. It's beautiful on the southwest Nova part of the province, and we really need to step up to the plate and start promoting that. Other partners that need to come together around that table, of course, are the departments of transportation, the departments of fisheries, and the departments of tourism to discuss some of the viability and solutions that we need to look at moving forward. And I really think, too, that, with the gateway monies that the federal government has indicated possibly investing in this province, I think as part of our gateway wish list, we really do need to look at equalizing those dollars across the province. We need to look at this particular service, this particular transportation link as a gateway link from the southwest part of the province. And it is important to our industry there, it's important to our economy there, and we need to look towards moving that forward in a way that makes sense for the whole province. So the gateway dollars that are available, or could be available rather, to this province, we need to seriously look at how we can make a proposal to the federal government to look seriously at this end of the province for gateway funds. I can't stress, too, the importance of the economy in southwest Nova and in rural Nova Scotia in general. We can't afford to lose one fishing job. We can't afford to lose one forestry job. We can't afford to lose one retail job that depends on transportation links in order to make their businesses and products viable. These industries are truly important. They play a big role in southwest Nova Scotia, and this link is critical to their survival. And as my colleague stated too, we have lost so many of our transportation links. We have seen a deficit in our infrastructure all across this province, and this is a deficit to see this particular transportation link struggle. And we need to start investing more money. We need to start investing more resources. We need to be strategic in planning for our future, our economic future, and our transportation links. We need to be looking at other markets. We need to be promoting ourselves in a bigger way, whether we're promoting our tourism, whether we're promoting our fishery products, whether we're promoting our forestry, high-tech products. we have a lot of work to do. I want to say, too, that I do know that Bay Ferries has invested into some renovations and maintenance and refurbishing of the ferry, and that's a good move forward. That's a start in the right direction. You know, that refurbishing and maintenance goes a long way to demonstrate the company's ability to look forward at promoting the ferry as an attractive ferry and a viable option. Mr. Speaker, we all need to work together, but government does need to take the lead on this. They need to step up to the plate a little bit more aggressively. They need to bring the partners together. We can't rely on necessarily New Brunswick as coming willingly at this point in time to the table. We need to get out there in front and start the dialogue and bring those partners together. I want to thank you, Mr. Speaker, for listening to this very important issue. I want to thank you, my colleague on the left side of me here, for bringing this very important issue to the forefront. And I encourage government to, and the Minister of Economic Development to continue with his concern and his willingness to be involved in this, and his willingness to understand the seriousness of this tremendous transportation link and tremendous economic opportunity that could be had if we can see the will to move this forward in the right direction. And that is keeping this transportation link a part of our investment strategy and infrastructure for the Southwest Nova Scotia. Thank you.
The Honourable, the Deputy Government House Leader.
Thank you, Mr. Speaker. I move that you do now leave the chair and we revert back into Committee of the Whole House on Supply.
Order, please. The Committee on Supply will now be called to order. The Honourable Member for Glace Bay.
Thank you, Mr. Chair. Mr. Chair, when we recessed for the further debate on another subject, previous to that we were talking about nursing graduates, and the Minister had indicated to me that some of the numbers that would be associated in the years to come with LPNs and RNs, and the additional numbers that we'd have within a couple of years for licensed practical nurses, and within 4 years for registered nurses. I had indicated previous to that by the year, according to the NSGEU, by the year 2010, there's a prediction that will be about 1,260 nurses short or so in the system. That's also an indication that is there within the Corpus Sanchez report as well. So if we were to maintain 100% of the nursing students who graduate, every one of them would come back and would work in Nova Scotia, and it's probably the Minister's hope, would be mine too. But if we were to do that, even then we would likely be about 500 nurses short in terms of the number. Is that correct, Mr. Minister? Would that be your calculation as well? If that wish were to come true, that every one of those additional nurses were to graduate and decide to work in Nova Scotia, we'd still have about 500 nurses short in this province of what we require.
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. Great to be back to be talking about the estimates for the Department of Health. And to be talking about the important issue of human health resources, and especially when it pertains to nursing in this province. The member opposite does do a good piece of math there. If we consider staying at the current model of care, staying in this method of care, we feel, as I've said before, with the changing the model of care, by changing the roles and responsibilities of people working on a floor, working within a unit, in my estimation, we would maybe change the number of nurses to other staffing ratios and things like that. So if we do it today, sure, we'd probably be short by somewhere close to 500 nurses. If we train, as I said before, 296 registered nurses will be graduating this year. 153 LPNs will be graduating. You know, we will be retaining somewhere close to 80% of those. So do that 80%, project it out 5 years, and you know, we come up with a number that of course will be a bit short. But I believe, again, with changing that model of care, we'll get a tremendous revamping of what that model of care looks like. I'm just looking what my deputy's writing here for me. But the shortage will be minimized, and the projected shortage will be delayed I believe, by changing this model of care. So today, I agree with the member opposite in the way that we do things, but I believe there's a big change coming that will alleviate some of the pressure that we see if we don't change.
The Honourable the Member for Glace Bay.
Thank you, Mr. Chair. I would assume then, if the minister's talking about some big change that is coming, and that, without getting too specific, one of the aspects of that change would be what you're going to do with our more experienced nurses. And I'll give you an example. I've used it here before. In many previous budget estimates and discussions in this House, an example of one of my sisters who's a nurse. I've used them many times before as examples of what's right and what's wrong with the system. They're right, the other part is wrong with the system. But in this one particular instance, my sister would be, I'm not going to say how old, she's in her 50s, we'll leave it at that. But soon, yeah, she's younger than I am. Soon she'll be approaching retirement. And I know that in her case and in a number of her friends' cases her friends that I've spoken with have said to me that when I reach that age, after having worked so long in this healthcare environment, and after having done the type of work that I've done in her case, in her friend's case, they're specialized nurses, they work in ICU, they've gone through enough to the point where they're saying, when I come to the age of retirement, the only way I'm ever going to see a hospital again is if I'm going there to get care. That's the only way I ever want to see a hospital again. And I'm not saying, I wouldn't say this about my sister, she's not burned out, because that would just be the wrong thing to say when I go back home to Glace Bay. I'd hear about it, but I would say that in terms of her work experience, that she may be approaching that point in whatever 3, 4, 5 years, whatever it's going to take in order for her to reach that time of retirement. So if the nursing initiatives that are going to deal with retaining more experienced nurses, those late career nurses, I'd be interested in knowing, when you talk about changes that are coming, exactly what changes you mean when you're talking about those more experienced nurses in the system, what you're going to do, and even how much you're willing to invest to use those nurses.
Thank you. The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, what I'll endeavour to do tomorrow is have a little more listing of the initiatives that are held within the NSNU contract on addressing the retention of late career nurses. There is a fair amount of incentive within that contract to do different things with these nurses. One of the items, again, as I mentioned earlier, is the nurse call line. It's a different way of doing work for those individuals who are burnt out from working on the floor, working in an ER, working in the OR. So it does give them an opportunity to use those skills that are very important to it. The other thing that I think is very important, that as we talk about primary care, I think there's a huge opportunity to take those individuals, put them into community care situations. You know, if we had a nurse, just a regular family practice nurse, you know, late career or what have you, working in Bear River, I know that community would welcome it with open arms. You know, there's many communities like the Bear Rivers who have looked at that different model of care for their citizens, and I want to commend the individuals at the Bear River Clinic for their perseverance and their work for making sure and ensuring that healthcare continues for those residents. And I know that the member for Digby-Annapolis has done his utmost in making sure that we, through the department and District Health Authority, help fund the primary care unit or the primary care functioning of that facility. I remember someone coming talking, bugging my ear the other day that they were looking for more money, but to offer more services. You know, I know that what I invest in that facility will reap benefits for the community surrounding Bear River. And those are the kind of things, I think those are the opportunities for nurses, I think, in this province as they, you know, move on in their careers. You know, there's got to be advancement within nursing in this province. You know, my deputy minister is probably a good example of advancement in nursing. You know, I know she worked on a floor at some point along her career, but she did, you know, upgrade herself, continue to work in different places. It became administration, and here she is 6 years now, 4 years now as Deputy Minister of Health in the province of Nova Scotia, managing a budget of close to $3 billion. And four as associate and four as deputy. So, you know, this to me is what is, yeah, she's babysitting a 38-year-old minister. But ultimately, you know, that's the kind of things I'm talking about. There's got to be opportunity for nurses in this province to advance, to change the work that they do. And I think from that, we'll retain those nurses throughout their careers, and they'll be happy with their jobs. You know, I want to see them happy with their jobs. I know when they started off with this, they were happy in the choice that they made to become nurses or healthcare practitioners. And you know, I want to see that joy come back. I mean, they need to be happy with what they do. So anyway, those are some, but I will endeavor to have what that contract information is, what those initiatives are that we agreed upon with the NSNU, and I'll have more detail on the nursing strategy and the things that we're doing within it.
Thank you. The honourable member for Clays Bay.
Thank you, Mr. Chair. I'm not even going to ask the deputy how many ministers she's been through. Or expect, yeah. in my time, that many as well. Yeah. The minister also referred to the member for Digby-Annapolis, who reminds me at every chance I get that we talk about a health care issue, to remind the minister that they don't have a nurse practitioner in Digby yet. And I'll do that again. But in all seriousness, look, and that is a serious issue. When you're dealing with late career nurses, I can understand the experience that would be there and the value they would be. But I would be more interested and pleased, I guess, if indeed we were doing something today so that they wouldn't get to the point that in 5 years down the road they do face that burnout issue, that indeed they would be wanting to come back and play some sort of integral role within the system and contribute toward the, and I'm trying to get out of the fact that I said my sister was approaching burnout. Yeah, and I'm glad the members opposite are keeping close track of that. If you looked at the Nova Scotia nursing strategy Minister, that was, according to that strategy that was released in April of 2007, it outlined a commitment to adopt the College of Registered Nurses late career nurses report recommendations as they related to work life and to the scope of practice issues and employment, retirement options, and respect, recognition, support for nursing work. So I'm interested if perhaps the minister could tell us and indicate whether that commitment that's contained in that report is going to be funded this fiscal year, or was it funded in last year's budget?
Thank you. The Honourable the Minister of Health.
We have funded the nursing strategy. There's multiple things in it. The list that this year is adding more to that strategy.
Thank you very much, Mr. Chair. We're just trying to confer amongst ourselves here. The nursing strategy year over year, the base this year for the nursing strategy is $5 million. Over and above that, I had listed off a number of items which were, I forget the total amount on that last number, which are over and above incentives and retentions for nurses in this province. Mr. Chair, also, I wanted to mention the excitement. And I know when we talk about changing model of care or a model of care initiative, I mean, it sounds kind of lip service-ish here in this House, because we don't understand, or I don't understand, the duties and responsibilities and all the things that nurses have to work to. But we know that talking about the model of care initiative, setting up the function group that is going to be working on the model of care initiative, that a number of those nurses that have been invited to work on this, and other nurses around the province, have delayed their retirement to work on this very important initiative. I think that's really important, because we're taking very experienced nurses who have been through the system for numbers of years that are going to be working on this change. This year, for nursing strategy, over and above the $5 million that is there year over year, the additional dollars for nursing is $4.9 million. So really, we've got almost $10 million in nursing strategy items for this year alone.
Thank you. The Honourable Member for Glace Bay.
I have one last question for the minister regarding the issue of nursing, and it's apparent, I guess, what the minister is saying. Don't mean to put words in his mouth, but what he appears to be saying is that the status quo doesn't seem to be working. That things have to change. So, within your entire budget envelope, nursing initiative or whatever the case may be, what would you be allocating? How would you allocate your resources differently? For example, would you spend more on recruitment? Would you spend more on retention? Would you spend more on renewal? Does the minister, if you can, share some of that information with us about what you're going to do differently to budget-wise to try and change the status quo?
Thank you. The Honourable the Minister of Health.
That's a really good one there. Right. Thank you very much, Mr. Chair. And what we're doing differently this year, and probably something that we haven't done a really good job of, is really advertising the profession of nursing to the public. You know, because I know that there are students out there that are looking to make decisions on their future. That had they had a little bit of push, a little bit of an idea that advertising would bring, that they would go along into that kind of profession. We have 20-somethings and 30-somethings that are looking for career changes, and I think by increasing our advertising budget, that would make a difference in that recruiting of it. I think what we're doing differently this year is trying to find a balance, not doing one or the other. A lot of years I think we did a lot on retention, but we didn't do anything on recruiting, or we did everything on recruiting, we didn't do anything on retention. Both of those things have to go hand in hand. And again, the other thing that I think that's going to make a big difference in retention of nurses in this province is allowing them to work to their full scope of practice, allowing nurses to be clinicians that really are dealing with the day-to-day well-being of their patients. What we find is happening more times than not that they're trying to do everything within the department, paperwork, light housekeeping, et cetera, the things that, you know, I shouldn't be paying a nurse to do. I should be paying a nurse to be the clinician that they're trained to be. And I think by that, you know, patient care will go up. The nursing staff will be happier because they'll be doing what they're actually trained to do. And you know, I think there's a huge you know, shift. There will be a huge shift in job satisfaction because of it. Going back to the distribution of dollars in the nursing strategy, and you know, you're trying to do the recommended a new nursing network. You know, there's a union in staff and management. You know, there's a whole bunch of initiatives that are held within it that are going to be changing the way that we treat nurses in this province.
Thank you. The honourable member for Glace Bay.
Thank you, Mr. Chair. And that was just on a related subject. And I think when the minister talks about again doing things differently, and you know whether we spend money on recruitment or retention, or do we do it both, or whatever, there's a perfect example that came before this House today, and in a couple of questions in question period to the minister, not regarding nurse, but a nurse practitioner. By the name of Don Lowe, who was looking to stay and work in this province. If you're going to change, and again, by implementing the use of nurse practitioners, you are implementing change, but if you have to change other things within the Department of Health within this province. In this instance, you have to change how long it takes to set up collaborative practice. Otherwise, you're going to lose more people like Don Lowe. And it was a perfect example that was there this afternoon because as was stated in question period, 7 graduates from a nurse practitioner graduates, 3 of them have already gone to Alberta. One more, who is Don Lowe, has been interviewed in New Brunswick and is about to make the trek to New Brunswick to go there. And in the meantime, what we're doing is the same old thing. We're making it harder for those people to locate in this province. Maybe not harder, it's just as difficult, I should say. But that, I would suggest that's the kind of thing we have to change, and whether that be red tape or bureaucracy or whatever at the departmental level, or whether it's at another level, or whether it's with DHAs or whatever the case may be, unless we make the change there, then the change is not going to find its way. It's not going to find its way to where it should and will make a big difference, and that is the retention, the recruitment of new people to this province, of new professionals, whether they be nurses, doctors, or nurse practitioners, unless we start making those changes. Because as the minister well knows, it's pretty heavy competition out there in terms of recruiting nurses or nurse practitioners or doctors. And if we have our people, specifically our people who are looking to stay in this province, we have to make it as attractive as we possibly can. And one of the attractions is making sure that they work their way through the system as quickly as possible without running into doors that are closed because of bureaucracy. And I know the minister knows that is a reality and that it's something he has to work on. And I would hope that the next time the minister gets a chance to speak on this subject, that he's probably going to make the announcement that they've just hired another nurse practitioner in Nova Scotia by the name of Don Lowe, who's setting up a practice, and away we go. I would hope that would be the next announcement he gets to make, knowing full well that there's more out there like that. It's not just a solitary case. It's becoming more of the norm. Here's the next subject that I wanted to talk about for the minister, and it's one that unfortunately I get to talk about way too much. In the last year, in 2007, I should say, across this province, the emergency rooms in this province were closed, dangerously close to the equivalent of 1 full year. And there were 6,299 hours, or 262 days, of emergency room closures. It represented a 60% increase over the previous year. Now, in the $1.1 million report on transforming healthcare, there's a recommendation that district health authorities should develop district emergency services models that will utilize staff across DHA sites as required. Physicians and nurses would provide coverage at sites alternate to their sites in order to address the temporary shortages or maintain sufficient staffing levels at the ERs that are having problems staying open. So I'd like the minister to indicate where and how much has been allocated in this budget to enable district health authorities to implement those service models.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And last year, let's talk about last year first. And we invested $36 million in payments to physicians, covering ERs and recruiting more than 30 new and replacement physicians to rural parts of the province. So, there's been a phenomenal amount of work that's been done in keeping the ones we have open. Mr. Chair, ERs as a total in this province are still open somewhere as close to 99% of the time. There are areas that have chronic problems of ER closures, Digby being one of them. I would like to see that nurse practitioner hired. I know the funding has been allocated. The District Health Authority is trying to recruit a nurse practitioner, but we're still having trouble in getting the nurse practitioners to go work in Digby. But at the same time, we have nurse practitioners looking at setting up in places like Hansport. So we need to have I think, a more strategic method in placing nurse practitioners in this province. We can't, if I was a doctor, and doctor's the wrong example, but if I'm a nurse and I say I want to work in this area, maybe I can't. Maybe I've got to move to another location in order to practice my education. And that's the challenge that we're really coming into with nurse practitioners. Just by saying and putting in a practice plan doesn't mean that the community of Hansport needs a nurse practitioner. I'm sure the community of Hansport wants a nurse practitioner. I'm sure that the community of Digby needs a nurse practitioner. I know the member for Hants West has talked quite often about this issue when it comes to Hants and the nurse practitioner that does want to work collaboratively with the doctor there. And we are trying to find a solution to make that work. But in the back of my head, I still have 2 vacancies in Digby. How do I fill that position? So that's a huge challenge for me. I can't necessarily talk of the dollars that will be available to ER doctors, closing in those barriers, open up those barriers for practicing and basically having a rotating pool of doctors that could work in a district and work at some of those other ERs, because some of that information is contained within the master agreement that was approved by Cabinet today that is going for ratification to Doctors Nova Scotia over the next number of weeks. So, I can talk globally that this year's increase, or over the next 5 years, the increase is somewhere in the vicinity of $108 million. Held within that are a number of initiatives that will allow district health authorities to better manage their pool of money, and therefore the pool of doctors that can work in some of these rural areas.
Thank you. The Honourable Member for Base Bay.
Thank you, Mr. Chair. There are a number of things that I could say in reply to what the minister has just said. But firstly, Mr. Minister, in all due respect, one of the solutions to filling those positions is to stop saying that 99% of the emergency rooms in this province are open. It doesn't do anyone any good in an area that has frequent emergency room closures. It doesn't do anybody any good in an area like Digby, where they're still waiting for nurse practitioner where the ER is closed, or at the example that I gave you today at Fisherman's Memorial Hospital or New Waterford Consolidated Hospital, which is closed more often than not, in Glace Bay's ER department, which is closed frequently, in the North Side Community General Hospital on the North Side, which suffers from the same problem. You know, we can say, and you can say that I don't think the figure is as high as 99%. But if you're going to keep using that as an excuse, in all due respect, stop saying that, and get on with the job of trying to find a solution to the problem of a lack of physicians and nurses and so on in the ERs that have the problem, with all due respect. And I was asking you with the service models that are there under the Transforming Healthcare report that was recommended. I did not get a direct answer to that, how much money has been allocated in the budget. But anyway, perhaps to answer this one, if you've had any requests from the district health authorities with regard to the creation of those service models, and if you have had any requests, what DHAs did they come from?
Thank you. The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And, you know, I know the member opposite is advocating on behalf of each individual hospital. And Mr. Chair, I can't just specifically think of one hospital at a time. I have to think of a system and how that system reacts to the healthcare needs of all Nova Scotians. So I know that at 99% or whatever that number is, that all Nova Scotians, whether it be through the ER, whether it be through the EHS system, have access 100% of the time to emergency care. And I cannot say that any more clearly than that. All Nova Scotians have access to emergency care, whether it be through the ERs that are open around this province. There are a number of ERs around this province. I forget what's my total number of ERs. There are 47 ERs across this province, or somewhere close to it. There is a emergency health system and ambulances that are providing a service to this province that is second to none. At the same time, I need to look at, do Nova Scotians have the best that we can offer? And I can say that yes, we're doing the best that we can with the resources that we have. And that, you know, if an emergency comes up, that they will be helped as best we possibly can with the professionalism and with the utmost training that we possibly can offer. It doesn't, I agree with the member opposite, it doesn't necessarily solve the issues for communities like Tatamagouche or places like Glace Bay or places like Digby. You know, we also need to find, I believe, a model of care for those communities, whether it be for the interim, whether it be for here into the future, of treating the people that are going through those doors in the first place. Mr. Chair, 70% of people, or 75% of people visiting the ERs today, all ERs, whether it be the one over here on Summer Street, that's got a $17 million expansion going up beside it, whether it be the one in Yarmouth, whether it be the one at the regional in Cape Breton. 75% of the people going through those doors are not there for emergency reasons. Okay? The model of care changed at some point from an outpatients facility to an ER. You know, there was a time when outpatients really was a community clinic that people went in to see their health care, to get their health care needs addressed. And we need to go back to some kind of model that provides those outpatient services, those primary care services, if you see where I'm going here. We need to provide another model for Nova Scotians to have their health care needs addressed, and let ERs become ERs, not community clinics. And I think, you know, through our nursing strategy, through our recruitment initiatives, through the new master agreement that has now been presented to Doctors Nova Scotia, I think we will see those changes and have better health care for all Nova Scotians.
Thank you. The honourable member for Glace Bay.
Thank you, Mr. Chair. Well, I didn't mean to start back and forth between myself and the minister, but since he's continued it, those ERs, I'll agree with the minister. There are, and the reports, various reports have shown that they're not used for exactly the purpose. But, Mr. Chair, the ERs, I know in my area anyway, are used as that other purpose that the minister says is community clinics because people have nowhere else to go. There are no community clinics open at that time. There are no community clinics in the community as well. And in some cases, I know in Glace Bay right now, there's a shortage of family doctors. And I know of cases where people who are suffering from, for instance, diabetes, who have had to go to the emergency room and wait for 6 hours so they can get a prescription refilled because they have no family doctor to go to. So, you know, the issue of ERs closing, again, is a little more complex than just saying you shouldn't use ERs for any other purpose except an emergency. If I'm a diabetic and I need a refill on my medication for diabetes, I consider that an emergency, that I don't have any family doctor or any doctor. And the person that I'm talking about in particular, who I spoke to, went to many family doctors and asked to be taken on as a patient, and they said, no, we can't take you on, we're strapped, and suggested that they go to the emergency room, and did wait for 6 hours to get a prescription filled for a medication that was absolutely necessary. And in his case, he thought it was an emergency. So I'll agree to a certain extent to with the minister that yes, we have that problem. But then I'll ask the minister, if we have that problem, I'll ask him now, does he have any proposals that are now before him and his department that would immediately help address the issue of emergency room closures?
Thank you. The Honourable Minister of Health.
I can tell the member opposite that if I had a true proposal that would stop this, I would be implementing it yesterday. We don't have that magic bullet that is going to keep these ERs open on a regular basis in the next number of months. Mr. Chair, going back to that, and I don't mean to start a go-between between me and the member, but quite honestly, I'm trying to look at things from a different angle. I mean, we need to look at things differently. That's why we have this House of Assembly. You know, we can sit here with differing views, but at the same time come to an agreement on issues that are important to our communities. What I am saying is that through our rural health strategy, the rural health strategy that will begin public consultations in the fall, I'm hoping September, we will look at these very, very issues that we talk about here in the House, that we hear of as on a regular basis as MLAs. Because in my estimation, it is the communities that better know their communities and know the solutions. You know, Bear River knew what their solution was, and they went for it. And we need to have more communities like that who basically take on the future of their communities when it comes to healthcare. But to the point of the people visiting the ERs, you know, there were from April 1, 2006 to March 31st, 2007, 715,136 emergency room visits. And each one of those people that visited those locations are seeing the most expensive part of our system. It is the most expensive part of our system. And wouldn't it be best if we could take 75% of that list and see them in a more appropriate method? You know, if the diabetic comes in and wants to wait and has to wait 6 hours for medication, wouldn't it be better? Wouldn't it be better for that individual to have gone to a pharmacist and had an extension put on his prescription? You know what? those are the very things that we need to address. They can't do that now. That's what we need. That's what we need to change. We need to change even the model of care for pharmacists is what I'm proposing. Is what we're talking about in a model of care change. Is what we're talking about in a rural health strategy. If I could take 75% of people out of that 715,000 person list and treat them more appropriately for, I don't know, half the cost, wouldn't it be better to take those dollars that I'm spending on ERs today and invest it in mental health, to invest it in some other part of the system that would better meet the needs of other Nova Scotians? So I don't mean to be standoffish on this one to the honourable member, and I appreciate his comments on this one. But at the same time, it is a large, complex issue that is being attacked by a bunch of different fronts.
Thank you. The honourable member for Glace Bay.
Thank you, Mr. Chair. And I really do appreciate the minister's comments. But this is not something that occurred overnight. I mean, you know, the minister didn't wake up yesterday and say, oh my, I think I'll go to work today. Hi, everybody. Hi, staff. Oh my gosh, there's an emergency room crisis. Emergency rooms are closed for almost a year. Since I've been here over the 9 years, and how many health ministers, this is a problem that existed back then when I first came here, a problem that has continued to worsen, and a problem that there seems to be, I don't know whether it's a reluctance or not accepting some of the solutions that have been put forward out there to try and solve this problem. Now the minister knows that one of the recommendations of the $1.1 million Corpus Sanchez report, and I think there's 100 and some recommendations, which the government said, we accept all. We accept all the recommendations of the Corpus Sanchez report. One of those recommendations was to initiate an immediate detailed review of emergency department services and facilities outside of the regional hospitals, and the intent was to identify operational efficiencies and care delivery improvements. I'll ask the minister, has that review been initiated?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair, and that review has started. And I look forward to reporting back to this House if it's still in session at that time, or I will present it directly to the member opposite on the findings of that report. Again, Mr. Chair, you know, what we have tried to do over the last number of years, knowing the human resource crunch that we've had, trying to find individuals to work in those areas. We have made changes at the ER that serves each region. You know, I know that in Cape Breton, and I commend the Cape Breton District Health Authority for the work that they do in making the best of a bad situation. You know, I know that if Northside is closed, that the regional is there backing it up. I know if Glace Bay is closed, I know the regional is backing it up. I know that if New Waterford is closed, I know Glace Bay is backing it up. So there's been a tremendous amount of work that's been done to ensure that there's enough backup within the system that Nova Scotians are being covered and can be treated as effectively and as effectively as it possibly can. But Mr. Chair, the other issue is, you know, there's a lot of people working within the system. There's a lot of expectations of communities, and you know, I think it's taken until now. I think until now that everybody's ready for change. Everybody's ready to look at some new ways of doing things. And only until everybody was on board are we going to be able to make these changes. And again, I am very excited about what can happen and what is going to happen to maintain these ERs and to make sure that they're open as much as they possibly can be open.
Thank you. The honourable member from Glace Bay's time expires at 7 7:17, so he's got approximately 4.5 minutes. The honourable member for Glace Bay.
Thank you, Mr. Chair. A couple more questions. We'll ride along with that theme of change, Mr. Minister. Under the primary health care initiatives, there is an increase of about $8 million or so. How much of that budget increase is being allocated to a 24/7 call line that's going to be staffed by nurses?
Thank you. The Honourable, the Minister of Health.
3.9, what's the 3.9? What's the total year? Okay.
That'll be opened January 1st because development plus 1 quarter operation.
1 quarter. Okay. Thank you very much, Mr. Chair, and I apologize for using up a little bit of the time there. But I want to make sure my numbers are right. $3.9 million will be utilized in the setup of the nurse call line. And the 3.9 will also cover, I believe, 1 quarter. We hope endeavoring to get this off the ground will take us until January to get it going. So we're looking at, again, some capital costs, some organizational costs of $3.9 million, where a quarter of that will keep it running from January to March. So we feel that the annual operating cost of this call line will be somewhere in the range of $6 million per year.
Thank you. The honourable member for Glace Bay.
Okay, thank you, Mr. Minister. So that 3.9, I'm assuming that you're going to hire nurses and so on to work on that initiative, and that 24/7 call line will be operational in January, you said. Okay. And with a review of emergency departments that you say is underway, that has been initiated, let me ask you this as my final question. And I would expect an honest answer here, Mr. Minister. Let me ask you then, do you intend, is it your intention and the government's intention to take that 24/7 call line staffed by nurses, and will that call line replace smaller emergency departments that you're going to close in this province?
The Honourable, the Minister of Health.
I could give it a short answer by simply saying no. What the member is talking about there is absolutely preposterous. It is preposterous, Mr. Chair. It is atrocious, Mr. Chair. I can't imagine that the member opposite, knowing full well that I have said that rural ERs will not close.
Order, please. It's very difficult for the chair to be able to hear the Minister of Health. I'm sure he doesn't need any help from any members. The Minister has the floor.
Thank you very much, Mr. Chair. And no, I really don't need the help of other members, but I do appreciate the occasional nudging along. But Mr. Chair, I do want to make sure, and I will say it again for this record, is that we will not be closing rural ERs. Mr. Chair. Any ERs. I will even go as far to say, as the member for New Waterford is telling me here, Cape Breton Centre. New Waterford makes a better sounding. Never mind. Anyway, rabbit tracks, and I'm getting stuck in them now. But ultimately, I have said, my Premier has said, that no ERs will be closing. And Mr. Chair, I look at the nurse call line as being a very, very good and smart initiative for the healthcare in Nova Scotians.
Thank you. The chair now recognizes the honourable member from Sackville-Cobequid.
Thank you, Mr. Chair. So where do we go from here? There's so much material, it really is. I mean, there's so little time, and there's so many concerns, And I know the minister just mentioned his government's commitment to keep all ERs open here in this province, and I hope they don't, those words don't turn around and bite them, Mr. Chair. I mean, that is so important, and it's such a concern with rural communities and the residents who are serviced by our hospitals like Roseway Hospital in Shelburne, Roseway, yeah. I might have said it wrong, Roseway. In Shelburne, Mr. Chair, that facility services so many people down in that area, and they're concerned. They've been writing letters. They've been calling MLAs, informing their member on what they've been hearing and some of their fears that they have. Also in New Waterford, the members mentioned the ER there many times, and I know that they've been struggling with closures. I believe last weekend they closed that hospital. I mean, the numbers speak for themselves, and I know the minister likes to quote the percentage of ERs that are open throughout the province in a given year, but over 6,000 hours ERs are closed in this province, Mr. Chair, and that's a staggering number, and it's not spread out to the 40-some or whatever number of ERs. It's concentrated in certain areas of this province, like Shelburne, like Digby, like New Waterford, all over this province in rural communities. It seems to have consistent problems in certain ERs. And it brings me to some of the questions that they have in these smaller ERs about their emergency rooms and the possibility of closures. Not only their emergency rooms, but the services they have in them, like X-ray and lab services. They're concerned that those areas in health delivery or healthcare are at risk of being phased out in these smaller rural communities. So my first question, can the minister confirm that X-rays and lab services, and I'll mention two areas of the province, in Canso and in Sherbrooke, will not see a reduction in services in the next year or even the next 2 years for X-ray and lab work in those facilities? Canso and Sherbrooke.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, there is no plan within our department to reduce services of that sort to communities like Sherbrooke and other communities around this province, like Shelburne, being served by the Roseway Hospital. Mr. Chair, the things that we do need to work on, and I've said it before, is that we need to have a newer model, one that the healthcare of Nova Scotians can be addressed in a more appropriate way. Like I've said before, we can't expect 75% of those patients going through the door. What they need to go to is maybe a walk-in clinic, a clinic with a nurse practitioner, a $4 million clinic like they're building in the community of Montagan. I know, Mr. Chair, in your riding, phenomenal facility that will better serve the needs of those individuals, rather than taking the trip to Yarmouth or what have you to the ER to see those doctors. So, there's other models and other investments that we have to do, which I believe we will hear and we'll be able to enact from the rural health strategy on this. There will be, because of the HHR crunch, there will have to be some rationalization of some services. The best example that we have today is lab services, right here in HRM, right here, even better, within 1,000 feet on University Avenue. 2 fully serviced, fully staffed labs. Why do we have 2 fully staffed, fully serviced labs on the same street serving the same population? Just because one was IWK and the other one was VG/Capital Health. And both of those organizations sort of went, what the heck are we doing? We know that Capital Health won't have its full staff complement because they're going to have to go and train some more. IWK wasn't going to have the right number of people in order to step. So why not we take all our resources and put them together? And not only that, use technology in a way that can better serve the patients. And I think what we see is a good model for other parts of the province that are going to have that very same HHR crunch. I've said this, I think, before here in this House, and I've said it before in other areas, that, medical laboratory technologists, we're going to have a bit of a crunch there, where, over half of those individuals by 2015, I think was the time, half of those people will be ready for retirement. So we need to find mechanisms, and I believe they're there. They're there technologically, technologically. They're there human resources wise to better serve the individuals in those communities. So does it mean that somebody in Sherbrooke is not going to be able to go get blood tests in Sherbrooke? Absolutely not. They're going to be able to go to that facility and they're going to be able to get their blood tests. Does it mean they're not going to be able to get their x-ray? No, it means they're going to be able to go and get their x-ray for the use of technology and other practitioners within the system. We just need to change the way we do things.
Thank you. The honourable member from Sackville-Cobequid.
And I couldn't agree more, Mr. Chair, about the need to change the way we do things. But it didn't, and it shouldn't have taken $1 million of taxpayers' money in the Corpus Sanchez report to wake up this government to look at the changes needed. We had the Commission on the Future of Healthcare in Canada in 2002, or the Romano report, which was the most comprehensive commission and report on healthcare that we ever had in Canada. And in that report, in that commission, Mr. Romano said we need to change the way we deliver healthcare. And in there, other parts of it that I've taken out of it is the fact that we need to support the public system. What we can't do is allow it to be eroded and head down the private sector and private delivery. But why I brought that up is the fact that government should have known that we needed to change the way we've been doing things for years. It shouldn't have been a $1 million report like the Corpus Sanchez, and at one point I believe, I don't know how many reports on healthcare that this province has done prior to your government and your government. I mean, if I'm not mistaken, there's probably been 100 reports in the last 15, maybe 20 years on healthcare, costing millions of dollars, and they all say the same thing. We need to change the way we deliver healthcare in this province, and I agree with that. What we need is a government to act on those and act on that. And with respect, it's too late in some circumstances. We're in positions that it'll take us many years to try to turn around the delivery system in certain respects in healthcare, and that leads me into some of the other questions I'm going to ask. The minister stated something that was quite evident: the fact that we have two labs doing the same thing. And what I'm going to ask around is the fact that we have the old Victoria General Hospital, which we all know is an old facility. We've outlived that facility. We need to change that facility, and we've heard the minister state that that's an option we're looking at. So maybe my first question is, what in this budget year has any money been allocated to, and I know it probably has, and I don't know where it is, but how much money has been allocated to looking at the need for the replacement of the Victoria General Hospital?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, just to go back to maybe a beginning comment of, yes, there has been a lot of reports and study done of our system. There's been a lot of reports and study done in other provinces across this great country of ours, looking at the very same issues that we're looking at. The difference, I think, this time, and where other strategies, studies have lost, is that they set a vision, they set a strategy, but they never set a state of readiness. People within the system, we as humans don't like change. And I can say that, in the past, people have been very reluctant to change. You know, why has the health system in Nova Scotia been reluctant to change? Well, they tried to change it back in the early 90s. You know, I think there was some merit in what was going on there, but the system itself got very frustrated with what was been trying to happen there. And it's taken until now to talk about change again, to say, you know, listen, you know, we're not going to repeat maybe some of those oversights, some of those mistakes. We're going to try to do it differently. And you know, I think the system and the people within the system are ready for that change. And I think that's what's fundamentally different than what the Royal Commission was, than what any other report is across Canada. So, you know, I'm very, very optimistic about this transformation process on where we're going to be going. In regards to infrastructure, tremendous issue that I'm sure has made my CFO grayer than he should be, is we have, I mean, we continue to estimate, we have an ongoing study right now to find out really, you know, how much of an infrastructure deficit we have. The biggest piece of that infrastructure deficit that we can see on a daily basis is the Victoria General Hospital. I mean, that hospital originally built, well, just the Centennial was built in 1967. The original part was built in 1950-something. Anyway, it's very well, I mean, it served the Nova Scotians very well, but is way past its life expectancy. And what we need to do is figure out, through this transformation, what services are held within that hospital that should not be held within that hospital. And I can tell you that there are a number of visiting clinics and diagnostic pieces and those kinds of things that really should be in different places. They should be maybe at the Dartmouth General, they should be at the Cobequid Health Centre, they should be in Truro, they should be somewhere else other than in the core. They should be more accessible to more Nova Scotians. You know, and even it's getting to be a challenge for individuals to visit from Dartmouth to get over to the Victoria General to get some kind of diagnostic. So we need to look at what those kind of services we need to have in a hospital, which ones we don't, and get those services out into the community where they can serve people better. And then we can look at the requirement for a new Victoria General Hospital. You know, what is it going to look like? What's it going to cost? And the District Health Authority is responsible for that planning. And we're expecting a report, we hope, by end of summer, I think is what our target really is on that one, to see what they're going to do with their aging infrastructure. We have a provincial, like I said, a provincial study going on, looking at our infrastructure across the province and what we're going to need. And Mr. Chair, this really helps me in talking about something that is important to this government, which is the issue of strategic infrastructure partnerships, which is why through the Minister of Infrastructure, or Transportation Infrastructure Renewal, that they've taken the issue of the Victoria General Hospital and put it through the test through Partnerships BC to see if there's an opportunity to address capital in that method. And, you know, ultimately, who knows what that report is going to show us in June. It could probably throw it out on its ear, and we're going to have to look at something else. It might say this is probably something we should do. But anyway, it will be based on the needs of Capital District. It will be based on the needs of the patients, but it will be all under the consultations. You know, CDHA is going out to the public. It is doing public consultations on their master plan, and I think that master plan will show us what we really need to do with that estimated $500 to $700 million building to rebuild. You know, it's a true infrastructure dilemma that we have with that facility.
Thank you. The honourable member for Sackville-Cobequid.
And the reason why I brought this up, Mr. Chair, is quite evident about the cost of delivering health care. When you have to duplicate something, as we have today, here we have the new HI down the road here. We have ORs in there. We have recovery rooms, intensive care units. Just a couple, not even maybe a kilometer down the road, we have the old VG where we have OR rooms, recovery rooms. I mean, we're duplicating everything. So I know that there's been something sent off to Partnership BC, so I'd like to ask the minister if he or his department made recommendations or support the construction of a new VG. So is that a priority for your department? And did you give any indication that that's really what you want to look at, how much it will cost for a new VG hospital?
Thank you. The Honourable the Minister of Health.
Yeah, thank you very much. And you know, I wish I had some more information. And really, maybe that's a bigger question for the Minister of Transportation and Infrastructure Renewal of exactly what was included in that package on what we're talking about replacing. But in my estimation, as I talked about, there are services in the VG that don't need to be in the VG. Number one, surgical services makes no sense. And from a cost standpoint, it makes no sense to be offering 2 surgical programs in 2 different locations. Which is why, you know, I'm hoping from the master plan that they will underline this issue. We need to move ORs, which were impacted not so long ago with a flood. We need to move those ORs to a central location. And in my estimation, it should go over to the infirmary site. We are constructing a brand new $17 million ER, which is basically a standoff building. And as far as I understand, there's some ideas and some preliminary plans anyway that would incorporate those new ER suites, the replacement ER suites, the OR suites, on top of that building or built in some way into that facility. I fail to understand, and I do need to talk to somebody about this because it's bothered me for a little while now, is why did they build that brand new hospital? Why did they build that brand new hospital and not amalgamate the services? You know, we could have had the VG doing one thing, we could have had the infirmary site doing something else. But that wasn't done back then, and I fail to understand. You know, I talked to the surgeons there, and you know, if you're doing a surgery over at VG, and all of a sudden you need an intervention with cardiac, well, cardiac's over at the infirmary site, and you have to get somebody from the infirmary site to get over to the VG site, and you might lose your window or opportunity by having those 2 programs in 2 different places. So, you know, it's something that has, you know, confused me of why, you know, back when that building was built, which wasn't really that long ago, it was 15 years old now, somewhere's in that range, you know, why weren't those surgical services done? Anyway, but going back to really your question is that we need to see, and through that master plan, what services need to be built into the new VG site and what doesn't need to be in. And I think there's some services there that need to go down to Cobequid, which is a better place to be accessed by anybody in the HRM rather than having to go all the way in here to the peninsula. There's other services that can go over in Dartmouth. There's other services that can go in different parts of the province. So I think as we rebuild that building, which we're going to have to do in the next 10 years, you know, that is going to be a different facility than what it is today.
Thank you. The Honourable Member for Sackville-Cobequid.
Well, I can't believe I'm going to say this, that I couldn't agree more with the minister. I really couldn't. But, Minister, to stand here and tell me I guess I have to talk to somebody, that concerns me because decisions are being made now. Money needs to be allocated now. We have, I don't know what you spent to send off to Partnership BC, over $200,000, I think, on 10 projects for them to look at. My fear is we're going to go down a road where we're going to have opinions, architects tell us, here's this nice new hospital we're going to build for $700 million, which will probably end up costing us $1 billion, when the right thing to do is just what you've mentioned, is the fact that we need to centralize ORs. Why the heck we have ORs at the VG and at the new HI, I don't understand. And I hope you start talking to somebody tonight and tomorrow and the next day about the fact that we need to have those ORs in the HI all together. I mean, we have cardiac cath, and then in one section of the thing we have services for the hospital. They don't need to be there. You know, build a complex next to it. And I know you've talked to similar people that I've talked to. Build a building next to it. You just got to take a walk through the HI and wonder, why are all these clinics, offices here when they could be housed in one apartment building or a building, office building, not apartment, office building. It doesn't make sense to me. And I hope we're not down the road too far that we can't backtrack or the government can't backtrack, because that's the way we should be going. Not seeking P3 solutions to replacing that hospital. Your government just spent $300 million leading up to the end of the year, Minister, and I know that's not all on your shoulders, it's on the Premier's shoulders. But my Lord, if that's what we need to do and it would save us money, then acute care should have been looked after on your spending spree and do something like what you just mentioned. I hope the Premier was sitting here listening to you, because I think you need to have a discussion with him to make sure he understands the importance of centralizing the ORs. And maybe he should have a talk with the same people I think we've talked to and I've talked to about that. I think that's where we need to go with it. The new ER, we're spending money to expand it. You know and I understand that we can build on that building. It's a great site. We can add floors, put an OR there, and you can close it at 5 o'clock. I know Dr. Bonger, who's head of Dallas Surgery, is very ambitious around addressing wait times in surgery, especially surgeries here in the province, and the wait times and the guarantee wait times that they're trying to obtain over the next 2 years. So I hope it's not too late and we don't go down the road too far where we can't get out of potentially entering into agreement to replace a hospital that might cost us near $1 billion, I think, by the time we finish all this. So I'm glad to hear some of those comments from you, but I hope you take it seriously and that you have those serious talks with the Premier and the government and your staff and the Deputy Minister. One of the things, and I know a member from Glace Bay mentioned it, I mentioned it to you today around nurse practitioners. I'm going to go back there because I'm trying to get a clearer answer. I understand the fact that we have areas in the province that have openings like Digby for nurse practitioners and elsewhere. I understand that, but we can't force people to go there. And my concern, especially when we see a nurse practitioner like Don Lowe, who's in Hantsport, which is a rural community, it's not downtown Halifax. I think they can service, and the physician she's been working with can service a great number of individuals in that area. Really, why has it taken so long? I mean, this started back in July when Don Lowe and the physician came to Capital Health with the idea of this collaborative practice. Why does it take so long for them to obtain a permission and a contract from your government? So quickly, are you going to approve a contract with them, and when maybe can we see that?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, we'll answer the last question first and the first question last. I see, approving a nurse practitioner in that way, but we need to be strategic. I mean, there are a lot of communities. I mean, 5 years ago, if you would have told, or 8 years ago, or whenever it started, I know the member for Digby Annapolis would better have the numbers for this, but when a nurse practitioner was given to Briar Island, Long Island, I mean, the community was completely up in arms that, oh my goodness, why would you give us this second-rate person? We want a doctor. You know what? If I went today and tried to pull a nurse practitioner at Long and Briar, there would be World War III. Because they're that well respected and that well needed. So there are communities around this province. Every community around this province is asking for a nurse practitioner. So we have to be strategic. I mean, we still don't have the millions of dollars to give everybody one. So we need to be strategic. Now, in this particular case, I became aware of it about a week ago, maybe 2 weeks ago, when the member for Hants West brought it to my attention. We still are trying to gather up, why this has happened, what the collaborative practice is going to look like, and how we can make it work. And I don't have all those details yet. So I know that we're looking into it, and over the next, I'm hoping the next number of days, and can have a true answer so that the nurse practitioner, Ms. Lowe, can make a decision. I would hope that she would make the decision to maybe stay around a little longer until we have this issue resolved. Going to the other issue, you know, I don't believe we should replace like for like when it comes to the infrastructure that we have. You know, if we're talking about transformation, let's truly transform what we see as facilities. You know, I know the member opposite sees a fund of $200 and some odd million as an amount of money that we could have put towards a new building, but the accounting principles don't let us do that either, where we can't pay a building forward. This building, through design and study and consultation, would take longer. Would probably take somewhere close to 5 years to build, so we would lose those dollars. And Mr. Chair, I am very happy in the investment that we did make in March on the issue of education, because it helps me out as Minister of Health, because it talks about debt relief, it talks about incentives, it talks about the cost of tuition for the students that are healthcare students. So I think that, you know, there is a true investment for healthcare, what we did, and I'm very proud of what we did. Now, Mr. Chair, again, to the member opposite, when it comes to the nurse practitioner for Hansport, and to my honourable colleague from the member from Hants West, we will endeavour to have a solution for that one as soon as possible.
Thank you. The honourable member for Sackville-Cobequid.
I'm glad, Mr. Chairman, that the member from Hants West brought this to the attention of the minister, because I told her to call the member from Hants West. And I don't know why, Mr. Minister, that 2 weeks ago is the first time you heard about it. I wrote to you about this last year. I wrote to you in October or November around this issue. And it's, you know, I have to commend someone like Don Lowe who said, I want to talk to people. I want to bring awareness around this, right? And I understand the minister's statement of we need to be strategically when we do this and have a strategy around it, but we're going to lose these nurse practitioners. The member from Glace Bay said there's 7 this year. I think he said 3 went to Alberta. I don't know if that's true or not, but I would think it probably is. Don Lowe's another one. New Brunswick has just announced they're going to hire about 40, I believe. PEI have said they're going to announce 7, and Don Lowe's have been up to Miramichi area with an interview and has already been given a contract if she wants it. Will she go? I hope she doesn't. I hope she doesn't. So I understand the fact there's some areas in the province where you need them, but when we have someone like this lady who's well trained and willing to work, I think waiting almost 10 months, if longer, just adds to their decision making to leave this province. And once she leaves, she's not going to come back for any amount of money, because she's going to remember the experience she's been through over the last 10 months. So I hope that you expedite that initiative. And I've mentioned this year after year in estimates around nurse practitioners, and I don't understand why we don't utilize them more, especially in our ERs. And I've mentioned it, and I believe I mentioned it last year to the minister, the fact that at the Cobequid Centre, we had a nurse practitioner who took advantage of a government initiative to go back to school and upgrade. She was working in the ER at Cobequid Community Health Centre and was unable to work to her full potential, to the scope of practice she was trained in. She wasn't allowed to. So here's a lady who was triaging patients and knowing, because of her training, that she could treat them and send them on their way, but she wasn't allowed to. And so I'm going to ask again, why, if we have nurses who are trained as nurse practitioners working in the system now, that they're not allowed to work to their full scope of practice? If it's policies and regulations we need to change within the regulatory body, then why aren't you making those suggestions and changing them? And let's do it. Let's get these nurses practicing so that we don't lose them. So that maybe that nurse at Cobequid, who now is in New Brunswick working, maybe she could work in Cobequid, and then when an opening in an area like the pilot project in Long and Briar comes up, you might be able to get that individual to go there. She's already working here. You know, that's when incentives work. when you say, listen, we love the work you're doing. We need someone like your expertise in Long-and-Briar, in Digby, in Shelburne County. And I have to say, the people along Briar Island and those areas that have been serviced by the nurse practitioner and the extended scope of practice of the paramedics, they're well served, and their opinions of that service that they're receiving is high. So I hope the minister understands where I'm coming from with that. So I'd like to go now to some of the line items that we have in the details, estimate details. And I'm going to go into now to, and I'll say the pages, so maybe you can have it open. I'll try to follow the pages. So it's 14.6, where we're at. And supplement, yeah, sorry, details. I know there's a ton of books there. So one of the questions I have, and these are kind of quick questions, maybe you can just give us some insight on what these line items actually contain and why they're here. The one is out-of-province hospital payments, and we have the estimate this year of $29 million. What exactly is found within that line item, out-of-province hospital payments? Why do we see that line item there? Why are those payments being made?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. That's simply the Nova Scotians who do travel outside the province, who need hospital care. It is the individuals who do have to go out of Nova Scotia in which to get some specialty treatments that are not offered here in Nova Scotia. I know the number does seem large, which is what, $29.491 million. But you know what, Mr. Chair, we also receive more patients in Nova Scotia than we actually pay for outside the province. So, I think there's actually a negative amount. If we look at, I don't actually have that number. I don't think. No, it's recorded elsewhere. Okay, it's recorded elsewhere. It's recorded elsewhere because of the new revenue policy. So it is actually listed separately, I think, through Department of Finance. But ultimately, we do pay for those individuals to go outside to receive care.
Thank you. The honourable member for Sackville-Cobequid.
And do you break that down to what we're paying other provinces or the states or wherever, and the amount we pay for individuals who can't receive a service in Nova Scotia? So what I'd like to see is that breakdown. Do you have an amount that we pay other provinces because we don't perform those procedures, or we send them to other jurisdictions outside the province?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, we don't have the detail with us tonight, but I will have that as soon as I can have it for the member opposite.
Thank you. The honourable member for Sackville-Cobequid.
Thank you. So now, of course, I'll go to emergency health services and the line items that we see there. I noticed under the ambulance subsidy, and then there's ground ambulance operations. So the $78 million roughly, I would assume is the amount of the contract that we have with EMC. Maybe I'd like to ask, why is the second line item of just shy of $1 million there, ground ambulance operations? Why is there two lines there? And maybe you can give me the reason why the lower number of about $1 million under ground operations is there.
Thank you. The Honourable Minister of Health.
Thank you very much. And just digging through the book here. You're correct on the first one. The 78 or so $1 million is the contract with EMC. The ground ambulance operations. Okay, I don't have it broken out there, but I'll try to get that for you tomorrow.
Thank you. The honourable member for Sackville-Cobequid.
So one of the things I do notice is the contract payment is up a little bit, and I'm sure that's because of increase in wages and that. But the ground ambulance operation is down quite a bit from last year's, close to $600,000. One of the things I know, and the minister and I found this out through doing some work on the cost. when an ER closes in the province, of course, the minister, when we question him on it, first thing is, 911. We have a great ambulance service, and we do, and they're there to pick up the slack, really, when a community ER, especially in the rural communities, is closed. And it's my understanding that with EMC and their responsibility to provide ambulance service, that additional pressure on them, they don't bear that cost. So I'm wondering if you could tell me, and you might not have it on you now, but where would I find and how much is the additional cost that we see when emergency rooms are closed throughout the province and EHS have to put an additional vehicle on or additional personnel in the emergency room?
Thank you. The Honourable Minister of Health.
Like, yes, for Capital Health, for example, we have put on 3 additional ambulances provided by.
Thank you very much, Mr. Chair. And I know the example the deputy is talking about here is even in Capital Health, we pay for an extra 3 ambulances to cover the extra times. We've talked a number of times in the speed of the ER. Sometimes ambulances are being stuck there for a very long period of time. So we pay through the District Health Authority for 3 extra ambulances to be on call during those peak times. And also, Mr. Chair, we will try to provide him with a little more information on how those dollars are spent out.
Thank you. The Honourable Member for Sackville-Cobequid.
Thanks. And specifically what I'm looking for is, what is it costing the province to provide that additional coverage when emergency rooms are closed? And I know you mentioned Capital Health, but usually we don't have too many emergency room closures in Capital Health. So it's mostly the rural communities. If you could provide that, that'd be great. One of the things, of course, is going to happen in a couple of weeks or a week is the changeover to Life Flight. I know that you've come into agreement with the EHS to provide that. Where is there a separate line item in the estimates that show that cost, and why is it not under EHS? Because it would be assumed by them the additional costs for providing Life Flight in the upcoming year.
Thank you. The Honourable Minister of Health.
Thank you very much. We're just trying to find which line item that did fit under, because there is no change in costing from the old model to the new model for it. Hold on, there we go. It's funny how that's working now. It's become 38 is making changes to my eyesight. $2.936 million is the funding for the air ambulance, and those dollars pretty much remain the same regardless of whose responsibility it was. So those dollars would be transferred to the new management team. And just to reply to the ground ambulance issue, the cost is for releasing the defibs, medical supplies, and running SAP. So those are the other added costs that we're covering on behalf of EHS and EMC.
Thank you. The Honourable Member for Sackville-Cobequid.
So I know I don't have too much more time left, so I won't go into other things. So I'll concentrate on this for another minute, and hopefully I know that some of your staff is here that might be able to get this information. My concern around the ground ambulance operation and trying to figure out why that is there is because we have on the line item $673,000 less this year than last year. So that's the question why I'm asking what the ground ambulance operation pertains and why is it such a drop in it. And I guess the other thing is, why wouldn't Life Flight fall under emergency health services in the budget line items under that heading? The other thing with the last minute or so, I'm just wondering if the minister is aware of a situation with Life Flight and the takeover to EMC around the Life Flight nurses and the paramedics that are working on that aircraft. It's my understanding that several of them, many of them, haven't been asked or haven't gained employment under EHS. So I'm wondering why these individuals and I believe it might even be 7 life flight nurses. Not too sure about the paramedics. Why did these life flight nurses lose their job because of a change of authority over who's going to run the life flight in the upcoming year?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. Mr. Chair, to make this one quick, when the transfer happened, there was a job offers that went out that you had to apply for those positions. There were a number of the flight nurses that did not apply for the new management of Life Flight. So I'm uncertain why that happened. I know there is one new paramedic that has been hired for that service. With that, I know where the time has come short. I do want to table one document, maybe for the benefit of the member for Sackville-Cobequid. Again, it's a picture of the Northwood site in Hammonds Plains Road, Bedford, but it also has on the back of it a diagram and a map from your house to the facility, so you know how to get there. So again, thank you very much for this evening.
Thank you. Thank you. Order, please. The time allotted for debate on supply has now expired. The Honourable, the Deputy Government House Leader.
Thank you, Mr. Chair. I would ask that you do now leave the chair and adjourn debate for today.
Great. Thank you. The Honourable, the Deputy Government House Leader.
Thank you, Mr. Speaker. I move that we adjourn for today, and House hours tomorrow will be from 8 a.m. to 2 p.m. Following the daily routine, move into Committee of the Whole House on Supply. Time permitting, government business to include private members' bills for second reading, Bill number 3, Bill number 81, Bill number 129. Time left after that, public bills for second reading. The following: Bill number 120, 126, 127, 130,